I'm Dr. David Hill, and today we're going to talk about how to relieve an earache. Now, earache just describes pain in the ear. The question is, why does the ear hurt? There are probably two main sources of ear pain. One is what we call swimmer's ear or an acute otitis externa. That is inflammation or infection of the tissue from the hole here all the way down to the eardrum. That's called the external auditory canal.
Earache symptoms can be an itchy, foul-smelling, painful boil. It may also be accompanied by high fever, nausea, vomiting, and diarrhea.
One of the most common causes of ear pain is temporomandibular joint dysfunction or irritation of the jaw joint. And although the inflammation is in the joint in front of your ear, the pain will radiate directly into your ear. Another cause of ear pain is something that we call referred pain. If you have a bad tonsil infection or throat infection, it will often cause pain shooting to your ear. So if you have ear pain in association with throat pain, the primary cause may not be the ear, but rather the throat. The treatment for ear pain will obviously depend upon the cause, and different causes will have different treatments.
Hi, I'm Hilary Talbot, acupressure physician and clinical herbalist. Today we will be discussing acupressure and ear pain. Now there could be a lot of different reasons why you're experiencing ear pain. It could be otitis media or an ear infection. It could be that there's something stuck in there, or maybe you're just having a cold and a little bit of your sinus cavities are slightly backed up. So a local point on the ear, there's actually three right here, and the tragus, which is this little pointy thing that comes off the face. And you can a lot of times pinch these points to try and help open the opening into the ear. And that's great if you're an adult and you're doing this on yourself. But chances are you're watching this because you have a child who's experiencing ear pain, because they get really, really fussy, especially when they're about age 2 or 3, when earaches can be kind of rampant. So I'm going to show you a point on the hand, which they won't even know that you're trying to affect their ear. 2 points actually, triple burner 2 and 3. 2 is located right here, and 3 is just on the other side of the joint. So pinching right here is great to do on the same side of the ear pain. And you can actually teach your child to do this if they want, or you can just kind of do it without them noticing in hopes that it kind of quiets them down and gets rid of the irritableness. So if your ear pain lasts more than 2 days, I encourage you to seek out an ear, nose, and throat doctor or an acupuncture physician who's skilled in treating earaches and sinus infections. Because if you let it go too long, you could have serious side effects like loss of hearing. And herbs can certainly be employed to help with ear infections if you don't want to go down the road of antibiotics. I'm Hilary Talbot, and that was acupressure for ear pain.
Now, earache is potentially one of the most painful conditions you can experience. There's an awful lot of nerves in the ear. They're very sensitive, and when there's inflammation or some other cause for pain, it can really be an incredibly distracting experience. So we should talk about what causes pain in the ear. And to talk about that, we have to talk about the parts of the ear. Now, in older people, the most common cause of ear pain is probably swimmer's ear. Doctors refer to that as otitis externa because it affects the external auditory canal. That's everything from the hole right here where sound goes in down to the eardrum. And that area is lined by relatively tender skin and tissue. If that tissue gets wet repeatedly, or there's something in there irritating it, maybe you tried to clear your ear or clean your ears out with a Q-tip and you scraped it, that can introduce infection. Infection in that area hurts. And the hallmark of an otitis externa, or outer ear infection, is that when you move this part of the ear, it hurts, or if you push here on this little button called the tragus. So if you have that, you probably need to see a doctor to get some antibiotic and anti-inflammatory drops to help it go away. Now, another part of the ear that can hurt is the middle ear. The middle ear is the air-filled space that starts on the inside of the eardrum and includes the bones that transmit sound to the cochlea, where nerves begin to interpret that sound for you. That's very common in young children and toddlers, and usually it follows a cold or sinus infection where fluid and pus is allowed to collect in the ear. That then gets infected, and the inflammation from the infection can be quite painful. Now, we used to want to treat all middle ear infections with antibiotics. We've learned, however, that for many children, leaving them alone is just fine because they're going to get themselves better anyway. And especially for children over the age of 2, the antibiotics don't make a dramatic difference in many cases in how fast they get better. On the other hand, in some complicated or particularly severe ear infections, antibiotics are needed. So to know what's going on, you pretty much have to take your child to a doctor who can look at the eardrum and see what sort of process is occurring in the middle ear. Now, you might also have pain as a result of too much air pressure or too little air pressure in the middle ear. This will happen if you've gone up and down a tall elevator, if you've taken off or landed in an airplane, if you've been scuba diving or swimming to the bottom of a pool. Anything that alters pressure in the middle ear can be painful. Usually yawning, chewing gum, or doing other things to open the jaw wide allows the pressure to equalize between the middle ear and the rest of the world, and usually that's going to resolve that pain. Talking about how to get rid of pain in the ear, I am Dr. David Hill.